Hey everyone, and welcome back to the channel. Today we're diving into a topic that might just change the way you think about your health, especially as you get older. We all believe health checkups are a cornerstone of good health, right? But what if I told you that after a certain age, some of these very checkups could actually be putting your life at risk? It sounds counterintuitive, I know, but the truth is, not all screenings and tests are created equal. And for those over 70, some common procedures might lead to more harm than good. Think false alarms, unnecessary stress, and even dangerous interventions. This isn't about fear-mongering. It's a critical conversation more and more medical professionals are having. The one-size-fits-all approach to healthcare is evolving, especially for seniors. In this video, we're going to pull back the curtain on 5 specific health checkups that many experienced doctors are now advising older adults to reconsider. We'll uncover why these tests are so frequently recommended, the hidden dangers they carry, and smarter, safer alternatives that keep you informed without putting your well-being on the line. If you're committed to your health but want to avoid being overtreated, overmedicated, or simply overwhelmed by today's complex healthcare system, then this video is for you. We're here to empower you with knowledge, confidence, and a clearer, more realistic picture of what truly supports your health after 70. Let's get started.
Number 1. The colonoscopy conundrum. For years, the colonoscopy has been hailed as the gold standard for preventing colon cancer. And for good reason. It saved countless lives. But here's the crucial twist. After age 70, especially if you're symptom-free and have no family history, this test can quietly become more harmful than helpful. That life-saving screening you had in your 50s or 60s can, past a certain point, transform into a source of unnecessary risk, significant stress, and even hospitalization. Why? Because the colonoscopy is no minor procedure. It demands a full bowel prep, sedation, and the insertion of a scope deep into your intestines. While taxing for a younger adult, for seniors, the risks escalate dramatically. The bowel cleansing process alone can trigger severe dehydration and dangerous electrolyte imbalances, both serious concerns for older bodies. And the sedatives? They can linger longer, leading to confusion, dizziness, and a heightened risk of falls. But there's an even more concerning aspect. Many older adults, particularly those over 75, undergo follow-up surgeries or treatments after a colonoscopy that detects small polyps that might never have caused harm in the first place. These slow-growing abnormalities often take 10 to 15 years to become serious. For someone in their 70s or 80s, those years may simply not come into play. Yet the discovery ignites fear, setting off a chain of procedures, biopsies, repeat scopes, even partial bowel removals, all in the name of prevention. But when the risks of these interventions outweigh the benefits, prevention itself becomes a source of harm. Consider my friend George, an active and sharp 82-year-old. He was persuaded to get a routine colonoscopy despite having no digestive issues. During the prep, he became severely dehydrated. After the procedure, he was groggy and confused, fell at home that night, and fractured his hip. That single test led to months of rehab, mounting medical bills, and immense stress. And what did the scope find? Absolutely nothing. This isn't about blaming doctors. They're following established protocols. But medicine is evolving, and we must evolve with it. If you're over 70 and experiencing no symptoms, it is absolutely reasonable to decline a colonoscopy. Safer, easier, and effective non-invasive stool tests are now available for many. It's about truly weighing the physical, emotional, and financial cost of putting your body through a procedure that may not actually help. We must stop assuming more testing always equates to better care. Because after 70, better care often means fewer interventions and more thoughtful, personalized choices. You're not neglecting your health by being cautious. You're honoring it. Number 2, the annual full body scan folly. There's something incredibly appealing about the idea of a full body scan, a machine meticulously examining you from head to toe, uncovering every hidden issue before it becomes a problem. Sounds like the ultimate proactive prevention, right? But for seniors over 70, this approach can surprisingly become more of a burden than a blessing. While the intention behind full body scans seems commendable, the outcomes they often produce can trigger a cascade of fear, invasive follow-up tests, and even unnecessary surgeries that, ironically, can shorten your life rather than extend it. Let's be clear, full body CT scans and MRIs are not your typical screening tools. These are powerful technologies designed to detect everything, and I mean everything, including harmless abnormalities that would never impact your health or lifespan. These incidental findings can quickly transform into psychological ticking bombs. A tiny nodule here, a subtle shadow there, and suddenly you're on a relentless merry-go-round of follow-up appointments, biopsies, and specialist consultations, all chasing something that might never have mattered. Why does this become more problematic after 70? Because the older body doesn't respond as it once did. A biopsy that might have been simple at 45 can now lead to a collapsed lung, a serious infection, or weeks of grueling recovery. Even something as seemingly routine as laying still for an MRI can be physically exhausting or painful for aging joints. And the emotional toll is often overlooked. Seniors frequently bear the heavy burden of worrying about what might be rather than truly enjoying the health they actually have. Take Betty, a vibrant 78-year-old woman I met. She walked daily, had no complaints, and was full of life. At a health fair, a mobile clinic offered her a discounted full body scan. They found a minuscule lesion on her kidney, so small it caused no issues and likely never would. But the word lesion was enough to ignite panic. Within a month, she was in surgery. The aftermath? Months of recovery, a significant drop in energy, and lingering complications that never quite resolved. All for something that might have remained silent forever. Medically, this is called overdiagnosis. Emotionally, it's unnecessary fear. And financially, it's draining. Full body scans are rarely covered by insurance, and many seniors pay out of pocket, believing they're purchasing peace of mind. What they're often buying is a ticket into a medical system that may never stop testing. True responsibility in this chapter of life looks different. It means trusting your body more, listening to how you feel, not just what machines report. It means recognizing that not every shadow on a screen deserves your precious energy or your peace of mind. If you're still watching and finding these insights valuable, please drop a comment with number 2 below to let me know you're here. And if you haven't already, please hit that subscribe button and turn on the notification bell so you don't miss any of our future videos. Your support helps us continue creating content to inform and inspire you. Now let's move on. Number 3, the overuse of cardiac stress tests. For decades, the treadmill stress test has been a go-to method for detecting heart disease, especially in older adults. The logic seems straightforward. Push your heart and observe its response under pressure. However, after the age of 70, this very logic can spectacularly backfire in ways many seniors don't realize until it's too late. What once was a genuinely useful tool in your 50s and early 60s becomes a questionable and sometimes outright dangerous procedure once you cross a certain age threshold. The primary reason? Cardiac stress tests in seniors frequently yield what doctors call false positives. This means the results might suggest you have a heart problem when in reality your heart is functioning perfectly fine. These misleading results occur because as we age, our bodies undergo natural changes. Arteries stiffen, blood pressure fluctuates more, and electrical patterns in the heart shift. None of these necessarily indicate disease. But the stress test doesn't differentiate. It simply flags something unusual, which can then trigger a cascade of fear and further, more invasive testing. This cascade can include angiograms, catheterizations, and in some cases even stent placements or bypass surgeries, all of which carry significant real risks. For seniors, these risks are far from minor. We're talking about potential bleeding, kidney injury from contrast dye, and dangerous drops in blood pressure. Surgeries become much harder to recover from and complications multiply. What begins as a simple treadmill test can tragically end with you in a hospital bed wondering how it all went wrong. Let me share George's story, a 74-year-old retired bus driver. He had no chest pain, no shortness of breath, no fatigue, just a routine physical where his doctor, just to be safe, ordered a stress test. The results came back borderline, and the next thing he knew, he was being referred to a cardiologist. Fast forward 3 weeks and he was undergoing an angioplasty for a blockage that hadn't caused a single symptom. Within a month of the procedure, George developed a severe infection at the catheter site, landed in the ICU, and spent the next 6 months in and out of rehab. His quality of life has never fully recovered. Now ask yourself, was that treadmill test truly worth it? The truth is, many leading heart specialists and geriatrics associations now strongly recommend against routine stress tests in asymptomatic older adults. They agree that if you're not experiencing any symptoms, no chest pain, no shortness of breath, no unexplained fatigue, there is often no benefit and significant potential for harm. This is especially true when your goal isn't to live forever, but to live well. Psychologically, there's a powerful allure to checking your heart. It feels central to who we are, the very heartbeat of life. So naturally, we want to ensure it's healthy. But here's where wisdom comes in. Healthy aging isn't about chasing every tiny potential problem. It's about listening to your body, maintaining your independence, and avoiding the kind of medical overreach that can take more than it gives. This doesn't mean ignoring your heart health, far from it. But instead of jumping on the treadmill at your doctor's office, focus on the fundamentals: daily walks, balanced meals, staying socially connected, and managing your stress. Those are the things that truly support your heart after 70. Not machines, not wires, not tests designed for people half your age. What we need most in this season of life is discernment, the courage to say no to something just because it's available, and the wisdom to understand that not every test is a gift. Sometimes declining a test is the most life-affirming decision you can make.
Number 4. The perils of routine prostate cancer screening, PSA test. For men, the prostate-specific antigen, or PSA test, has long been a standard part of annual checkups, touted as a crucial tool for detecting prostate cancer early. And while early detection can be vital, for many men over 70, especially those without symptoms or a strong family history, the routine PSA test can lead to more anxiety and unnecessary procedures than actual life-saving benefits. Here's why. The PSA test isn't perfect. It measures a protein produced by the prostate, and elevated levels can indicate cancer, but they can also be caused by many other benign conditions common in older men, like an enlarged prostate or infection. This often leads to false positives, triggering a cascade of follow-up tests, including biopsies. A prostate biopsy, while generally safe, is an invasive procedure that carries risks like infection, bleeding, and pain. For an older man, recovering from these can be more challenging. But the biggest concern lies in overdiagnosis and overtreatment. Many prostate cancers, especially in older men, are slow-growing and may never cause symptoms or become life-threatening. They are often referred to as indolent cancers. If detected, even these harmless cancers can lead to aggressive treatments like surgery or radiation, which come with serious side effects such as incontinence, erectile dysfunction, and bowel problems. For a man in his 70s or 80s, the potential for these debilitating side effects to significantly impact his quality of life often outweighs the minimal, if any, benefit of treating a cancer that might never have caused him any harm. Consider John, a healthy 79-year-old. His PSA level came back slightly elevated. Despite no symptoms, his doctor recommended a biopsy, which confirmed a low-grade prostate cancer. John chose surgery, and while the cancer was removed, he now struggles with incontinence, severely impacting his active lifestyle. He often wonders if he would have been better off never knowing about a cancer that might have remained silent for the rest of his life. Leading medical organizations, including the American Academy of Family Physicians and the U.S. Preventative Services Task Force, now recommend against routine PSA screening for men over 70 who are asymptomatic. They emphasize shared decision-making, where the patient and doctor discuss the potential benefits and harms based on the individual's health, life expectancy, and values. This isn't about ignoring your health. It's about being smart. Instead of routine screening, focus on discussing any urinary changes or symptoms with your doctor. Being informed means understanding that not every abnormality needs aggressive intervention, especially when the treatment itself can diminish your quality of life. For many seniors, the goal shifts from simply extending life at any cost to preserving vitality, independence, and comfort. Sometimes, the wisest choice is to monitor and observe, rather than intervene. Number 5. The overuse of routine cardiac stress tests, re-emphasized and refined. There's something about heart disease that makes it feel like a ticking bomb. You hear stories of someone who seemed perfectly healthy one day, only to suddenly collapse the next. So it's completely natural to want to catch any issues early. That's precisely why cardiac stress tests, those treadmill or chemical tests that monitor your heart's response under pressure, have become so common, especially among people over 70. But here's the surprising and critical truth. For many seniors, Particularly those without any cardiac symptoms, these tests often do more harm than good. The concept behind a stress test sounds reassuring. You walk on a treadmill, they track your heartbeat, and if something looks off, they take action. But the reality is far more complex. Most individuals over 70 already exhibit age-related changes in their cardiovascular system. Mild stiffness in the arteries, a bit of plaque here and there, or a slower recovery time after exertion. These are frequently normal signs of aging. However, when these show up on a stress test, doctors may interpret them as red flags, prompting further, often unnecessary testing and even invasive procedures like angiograms or stent insertions. And that's where things get truly risky. Those follow-up procedures are not without significant consequences. Catheterizations can lead to bleeding, stroke, or kidney damage, especially in older adults with more fragile blood vessels and reduced kidney function. And once you embark on that path, it's incredibly difficult to turn back. One test leads to another, then another, and before you know it, you've gone through a cascade of interventions for a condition that may never have caused you any problems in the first place. Take Harold, my 76-year-old grandfather from Illinois. He felt perfectly fine, walked daily, played with his grandkids, and had no chest pain or shortness of breath. At his annual checkup, his doctor suggested a stress test just to be sure. The test revealed a minor abnormality that led to a cardiac catheterization, which in turn showed some non-obstructive plaque. The doctors placed a stent anyway. After the procedure, Harold developed a severe complication from the blood thinners, landed in the hospital with internal bleeding, and spent the next 3 months recovering. All from a test he didn't need, based on a problem that wasn't urgent. So why does this happen? Part of it is fear of missing something, fear of what might happen if we don't act. But at this stage of life, it's paramount to prioritize quality over mere quantity. It's about preserving energy, independence, and comfort, rather than chasing problems that haven't even manifested. Many respected cardiologists now strongly advise against routine stress testing in older adults who don't have symptoms. The evidence is simply not strong enough to support it. It doesn't reduce heart attacks, it doesn't lower mortality, and for those without active signs like chest discomfort, shortness of breath during minimal exertion, or dizziness, it's not only unnecessary but potentially dangerous. The smarter path is symptom-based care. If you're experiencing changes in how you feel during activity, unusual fatigue, pressure, a racing heartbeat, then yes, a thorough evaluation makes sense. But if you're feeling steady, sleeping well, and staying active, your body is already telling you a more accurate story than any machine can. As we age, we must shift from aggressive intervention to thoughtful observation. It's not about giving up, it's about living wisely. You don't need to fight every possible disease. You need to protect your time, your clarity, and your dignity. Growing older doesn't mean growing helpless. If anything, it's the time in life when we're finally wise enough to question the system, to slow down and ask, is this really for me? You see, in a world that often glorifies more checkups, more screenings, more pills, sometimes the bravest and most beneficial choice is actually doing less. And not out of neglect, but out of a deep understanding of your body, your values, and your true goals. At this stage of life, healthcare in your 70s and beyond shouldn't be a conveyor belt of automatic tests and impersonal routines. It should be a thoughtful conversation about what truly matters to you, how you want to live, and what risks you're genuinely willing to take. Blindly following protocols designed for younger bodies can rob you of energy, peace of mind, and even precious years off your life. Not because doctors mean harm, but because they're trained in a system that often chases disease instead of honoring holistic health and well-being. If this video made you think twice, if it gave you a new lens through which to view your health, then it's already done its most important job. And remember, saying no to certain tests doesn't mean you're ignoring your health. It means you're being deliberate. You're weighing the potential benefit against the burden. You're recognizing that not every test leads to clarity. Some lead straight into the maze of overdiagnosis, anxiety, and unnecessary treatment. So take ownership,
Talk openly and honestly with your doctor. Ask whether a test is truly likely to change your outcome, or just add to the paperwork. Think about your time, your energy, and your comfort, because at this age, those are truly precious. You've earned the right to live on your terms, not fearfully, but thoughtfully, not overloaded with procedures, but empowered with knowledge, and not constantly preparing for sickness, but actively creating a life rich with meaning, joy, and connection. Thank you so much for joining us today. We'd absolutely love to hear from you. Please leave a comment below and share one key insight you gained from today's video and how you plan to use it in your own life. Your thoughts are incredibly important to us, and reading your comments gives us immense motivation and encouragement. If you found this video helpful and enjoyed it, please give it a big thumbs up, subscribe to our channel, and share it with someone who might benefit. Your support truly helps us continue creating valuable content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next one.